Confidentiality refers to the legal and ethical obligation of healthcare providers to protect patient information and keep it private. Maintaining confidentiality is crucial for building trust with patients and ensuring that patients feel comfortable sharing their personal and medical information with their healthcare providers. This presentation will provide an overview of the legal and ethical frameworks that govern confidentiality in healthcare, the importance of obtaining patient consent, the limits of confidentiality, and best practices for maintaining patient confidentiality in healthcare. Healthcare providers are governed by both legal and ethical frameworks that require them to maintain patient confidentiality. Laws such as the Health Insurance Portability and Accountability Act, HIPAA, and ethical codes such as those set forth by professional organizations like the American Medical Association, AMA, outline the standards for confidentiality in healthcare. Examples of laws and regulations related to confidentiality. Example, HIPAA. HIPAA is a federal law that sets standards for the privacy and security of patient health information. Other laws and regulations related to confidentiality in healthcare may vary by state or region. Patients are more likely to trust healthcare providers who demonstrate a commitment to protecting their privacy and maintaining confidentiality. Plenty of examples show how breaches of confidentiality can damage patient trust. Breaches of confidentiality can erode patient trust and result in negative outcomes such as patients withholding important medical information or seeking care elsewhere. The importance of obtaining patient consent for disclosure of information. Patients have the right to control their own medical information and must give consent for healthcare providers to disclose that information to others. Situations where patient consent may be required include sharing information with family members or caregivers, referring patients to specialists or other healthcare providers, and conducting research studies. Limits of confidentiality. Healthcare providers may need to disclose information to protect the health and safety of the patient or others, or when required by law. Examples of situations where healthcare providers may need to disclose information despite patient confidentiality include reporting communicable diseases, reporting child abuse or neglect, or warning others when a patient poses a risk of harm to themselves or others. Types of confidential information. The different types of confidential information that healthcare providers may encounter include medical records, personal information. Healthcare providers may encounter a range of confidential information, including medical records, personal information, and sensitive information such as mental health or substance abuse history. Healthcare providers should take steps to protect each type of confidential information, including storing medical records securely, limiting access to personal information, and avoiding unnecessary disclosure of sensitive information. Sharing information with family and caregivers. Healthcare providers can share information with family and caregivers while still maintaining patient confidentiality. Healthcare providers can share information with family members and caregivers as long as they obtain patient consent and limit the scope of disclosure to only the information necessary for the intended purpose. Examples of how to limit the scope of disclosure in these situations. If a patient's family member is involved in their care, the healthcare provider should only share information about the patient's medical condition and treatment plan and avoid disclosing other personal or sensitive information. Disclosure to other healthcare providers. Healthcare providers can share information with other providers while still maintaining patient confidentiality. Healthcare providers can share information with other providers as long as they obtain patient consent and limit the scope of disclosure to only the information necessary for the intended purpose. Examples of situations where healthcare providers may need to share information with other providers as referrals, consultations. Healthcare providers may need to share information with other providers in situations such as referrals to specialists, consultations with other healthcare professionals, or transfers of care. Research studies and confidentiality. Healthcare providers should obtain patient consent and follow ethical guidelines for research studies to protect patient confidentiality. Examples of ethical guidelines for research studies include informed consent, data de-identification. Ethical guidelines for research studies include obtaining informed consent from patients, de-identifying data to protect patient privacy, and following protocols for storing and securing research data. Electronic health records and confidentiality. Electronic health records, EHRs, can improve patient care and coordination among healthcare providers, but also raise concerns about patient privacy and data security. Examples of best practices for securing EHRs and protecting patient confidentiality include password protection, data encryption. Best practices for securing EHRs include password protection, data encryption, and limiting access to only those who need the information. Breaches of confidentiality. A breach of confidentiality occurs when healthcare providers disclose patient information without proper authorization or outside the scope of their responsibilities. Consequences can include disciplinary action, legal liability, and damage to patient trust. Breaches of confidentiality can occur via unauthorized access to patient records. Accidental disclosure. Breaches of confidentiality can occur through unauthorized access to patient records, accidental disclosure of information, or intentional violations of patient privacy. Responding to breaches of confidentiality. Healthcare providers should promptly notify patients and take steps to mitigate the impact of the breach, such as offering credit monitoring or identity theft protection. Best practices for responding to breaches of confidentiality include developing a breach response plan, conducting a thorough investigation. Best practices for responding to breaches of confidentiality include developing a breach response plan, conducting a thorough investigation to determine the cause and scope of the breach, and taking steps to prevent future breaches. Training and education. Healthcare providers should receive regular training and education on confidentiality to ensure that they understand the legal and ethical frameworks that govern patient privacy and confidentiality. Examples of topics that should be covered in training and education on confidentiality include HIPAA regulations, patient consent. Training and education on confidentiality should cover topics such as HIPAA regulations, patient consent, and best practices for protecting patient privacy. Conclusion. Maintaining patient confidentiality is crucial for building trust with patients and ensuring that patients feel comfortable sharing their personal and medical information with their healthcare providers. Healthcare providers must follow legal and ethical frameworks for maintaining patient confidentiality, obtain patient consent for disclosure of information, and take steps to protect patient information from breaches. Call to action. Healthcare providers should prioritize patient confidentiality in their practice and take steps to ensure that they are following best practices for protecting patient privacy. You may refer to above for further reading. Let's start with MCQs. What is the primary reason for maintaining patient confidentiality in healthcare? A. To protect patient privacy and dignity. B. To avoid legal liability. C. To improve patient outcomes. D. To increase revenue. Answer A. What is the legal framework that governs patient confidentiality in healthcare? A. OSHA. B. HIPAA. C. IMTALA. D. ADA. Answer B. Which of the following is not an example of protected health information, FI? A. Patient name. B. Social security number. C. Date of birth. D. Patient's employer. Answer D. What is the role of patient consent in disclosure of fee? A. It is not necessary. B. It is only necessary in emergency situations. C. It is necessary in all situations except for emergency treatment. D. It is necessary in all situations. Answer C. What are the potential consequences for healthcare providers who breach patient confidentiality? A. Disciplinary action. B. Legal liability. C. Damage to patient trust. D. All of the above. Answer D. Which of the following is an example of a breach of confidentiality? A. Sharing patient information with a healthcare provider involved in the patient's care. B. Accidentally emailing patient information to the wrong person. C. Disclosing fee to a patient's family member without the patient's consent. D. None of the above. Answer C. How can healthcare providers protect patient confidentiality in research studies? A. By obtaining informed consent from patients. B. By de-identifying data to protect patient privacy. C. By following ethical guidelines for research studies. D. All of the above. Answer D. What is the potential impact of electronic health records, EHRs, on patient confidentiality? A. Improved patient care. B. Increased risk of data breaches. C. Increased patient privacy. D. Reduced coordination among healthcare providers. Answer B. What should healthcare providers do in response to breaches of confidentiality? A. Offer credit monitoring or identity theft protection to affected patients. B. Notify affected patients promptly. C. Investigate the cause and scope of the breach. D. All of the above. Answer D. What should healthcare providers do to prevent breaches of confidentiality? A. Limit access to patient information to only those who need it. B. Use strong passwords and data encryption to protect EHRs. C. Train staff on best practices for protecting patient privacy. D. All of the above. Answer D. What should be covered in training and education for healthcare providers on confidentiality? A. HIPAA regulations. B. Patient consent. C. Best practices for protecting patient privacy. D. All of the above. Answer D. What is the primary benefit of maintaining patient confidentiality? A. Improved patient outcomes. B. Increased revenue. C. Protection of patient privacy and dignity. D. Avoidance of legal liability. Answer C. What is the difference between confidentiality and privacy in healthcare? A. Confidentiality refers to the protection of patient information, while privacy refers to the patient's right to control their personal information. B. Confidentiality refers to the patient's right to control their personal information, while privacy refers to the protection of patient information. C. There is no difference between confidentiality and privacy in healthcare. D. Both confidentiality and privacy refer to the same concept in healthcare. Answer A. Who is responsible for maintaining patient confidentiality in healthcare? A. Only the healthcare provider who has access to the patient's information. B. Only the patient. C. Both the healthcare provider and the patient. D. None of the above. Answer C. Thank you for time and attention. Contact information for further discussion or questions.